Welcome to Ask Dr. Mingle, a Q&A series for Mingle Health where we take your questions about quality programs and the transition to value-based care. I'm Kyle Breckel. I'm a digital marketing specialist here at Mingle Health, and I'll be hosting this episode along with Dr. Dan Mingle, founder and executive chairman of Mingle Health. Good morning, Dr. Mingle.
Good morning, Kyle, and good day to all of you tuning in. It's great to see you again. I am Dr. Mingle, and I'm here to answer your questions to the best of my ability.
Before we get started, I want to invite our listeners to send us their questions for Dr. Mingle. You can leave your questions in a comment on LinkedIn or YouTube, or you can email them directly to us at hello@minglehealth.com. And today, Dr. Mingle, we have some questions about cybersecurity.
Well, thanks, Kyle. We get a lot of questions about cybersecurity. It's a concern of a lot of our clients. I decided to devote this session to a couple of those key questions. But I'm not going to answer specifically about cybersecurity. I'm going to talk in terms of HIPAA, privacy and security. Now, privacy and security are a little different. I think they're two sides of the same coin, but I view privacy as the case by case individual application of the principles, where an individual's healthcare information is potentially shared with someone who shouldn't have access to it. And it's typically a variation on desired protocols by an individual. It could be inadvertent, usually is, or deliberate. Security, I picture as a mass casualty of privacy, and there's both physical and technical aspects to security. So those technical aspects, I think, is a synonym of cybersecurity, but you're not really addressing the whole gamut until you look at the physical with the cybersecurity issues. So I think it's important to have all this in mind. Now, HIPAA, that's the Health Insurance Portability and Accountability Act, was voted into place in 1996, and of course has been amended many times since then. It goes hand in hand. It's affected by state regulations, and typically the more restrictive of the two is what you have to, element by element. The more restrictive of the two is the one that you need to pay attention to. HIPAA compliance HIPAA is a compliance issue, but it doesn't act like many of the other compliance programs that you come into contact with. I'm not aware of any random or routine audits of HIPAA. It tends to be incident centric, based on complaints or reporting that involve you, and the investigation of the issue may lead to civil and criminal consequences. Now, insurance carriers are interested. If you're buying cyber insurance, they're going to want you to describe and perhaps probably share with them your policies and procedures. I'm not aware of any that have actually come to the office to confirm that you're following your procedures, but it's certainly possible. And potential business contracts, that's where we run into it, that as we get into contracting issues with healthcare systems and others, that there's a variety of questionnaires and investigations we're prone to receive to prove our HIPAA privacy and security. Now, you might bring up MIPS, and the promoting interoperability performance category is an example of the compliance and a more routine investigation. And you'd be right, except that there's not much teeth in the promoting interoperability rules. We've experienced one measure throughout the promoting interoperability lifespan, and that's been the annual security assessment. That you're asked a question: have you performed a security assessment in the last year? And the right answer is yes. And it's unscored, but it's necessary. You don't get any score for the category unless you answer yes to that question. Now, in the description in Medicare specs, it talks about appropriate action based on the assessment, but the measure is based on attestation that you've done a security assessment. And you'd be hard pressed to, or Medicare would be hard pressed to audit you and fault you for not taking action because they're not requiring that in the attestation. The new measure, it relates to a set of what Medicare calls safer guides. Or the Office of the National Coordinator has published called Safer Guides. And now you're required to answer a question: have you read the High Priority Practices Safer Guide? One of, I think there's 9 of those guides. And today, or for this year, either a yes or no answer qualifies you to score your well, it's not scored, but again, it's required. If you don't answer the question, you don't get any promoting interoperability points. But a yes or no answer today qualifies you for the question. But I'm sure in years to come, it might be as soon as this coming year or shortly after that, a yes answer be required. And if it's anything like the security assessment, that's how it's going to roll out permanently, just a yes answer to that, to having read that guide. So with that, let's get to the 2 questions that have boiled this issue down to.
Yeah, that sounds great. Our first question today comes from Linda. And Linda asks, do you have a repository of compliance forms that my organization can follow to help with our cybersecurity? I'm looking for things like security breach incident response plans to satisfy an active cybersecurity insurance application.
Well, Linda, thanks for the great question. Now, I like to be helpful, and I often share the materials that I have or am using. But there's a couple of reasons I might not that it might not be a good idea in this case. First, we hired a third party to help us create our policies and procedures. It's customized to our strengths and weaknesses, our role with data, our relationship with our clients, uh, our internal resources. I'm not sure I have the right to share the work of a third party to groups outside our organization. But that shouldn't be a barrier to you. There is lots of information in the public domain, and a internet search should yield a decent boilerplate for a security breach incident report and response plan, or anything else you need for that application. Um, uh, Second, our organization is significantly different than yours, and things that fit us are unlikely to, or may not be a good fit for you. So again, I think a better place is a boilerplate document uh, that you can change to your own needs, uh, uh, and or contacting a third party to help you with that. There are some great, as some of the best resources I'm aware of in the public domain, published by the Office of the National Coordinator for Health IT. The ONC is publishing 2 documents and related tools that are pretty easy reads, support self-service, and a great introduction to the topic set. Um, and that is at www.healthit.gov, searching for security risk assessment tool and searching for safer guides. Uh, they're all published there, all available. And as you read through it, you'll find other links to pertinent resources, either inside and outside the ONC, that will help.
Yeah, and be sure to check the YouTube description and blog post for this episode on our website. I'll be posting the links you're mentioning in both of those places. And our second question today is from Brian. And Brian asks, I am the director of IT in a mid sized single specialty practice with multiple locations. I've been assigned the task of implementing privacy and security policies. As a compliance requirement, shouldn't our legal counsel take charge of this? I know I don't have the authority, and I don't feel like I have the expertise to implement and monitor the program. Can you help me push back to get this in the hands of the right leader?
Brian, great question. And a lot of my clients struggle with this issue. Um, I'm I'm not sure I'm going to please you with my answer. Uh, in my experience, this often, I hesitate to say usually, but it might be usually, falls into the hand of someone in a role like yours, director of IT. In fact, in our program, our director of IT has taken charge of that set of documents and implementation, uh, and at least is contributing to the training around it. I think in your organization, there are three important roles, and they do vary organization by organization who takes it on. There's someone who coordinates the effort of creating or downloading and modifying the documents to your purposes, maintain that documentation, amend it as required, and oversights the new implementations. There's if you're doing this in compliance with the regulations, you will have a privacy officer who is indicated within those documents. And it could be you, but I think this is where you might assign it or look for volunteers, or if your leadership team looks for volunteers. The privacy officer for us, our director of human resources. I think that's a great place. My experience suggests that is a there's more variation in who takes charge of this than implementing the policies. Um, but that person typically has a daily relationship with the employees. Is in our case easy to contact and talk to, and it's a great place to bring those reports of potential privacy uh, lapses. You'll also need a security officer. Now, in our case, that's the person under the director of IT who's responsible for our network maintenance, and that person is responsible. One, to take on any complaints or reports that are made, but also to oversee those security efforts, like password or two-factor authentication, encryption at rest, encryption in transit, virtual private network, all of those things that technologically and physically protect your data. Um, so again, it can be any number of people in your system. One person can do all of them in some cases. A couple of other important roles in your organization. Ultimately, your leadership, and if there's a board of directors in your program, it's a board of directors who takes responsibility for this. And when you propose a set of policies and procedures that needs to go up the chain and be ratified by, which of course takes you off the hook. They may kick back and demand things that you don't want to do, but they are ultimately responsible for the program. HR needs to include, your human resources department needs to include training on these issues for your new hires, and annual updates for everyone, including leadership. And everyone, I think the biggest reason that this can't sit on one person's shoulders and doesn't sit on one person's shoulders is it only works as everyone is involved. And it's a day-to-day thing. When we first implemented our policy and procedure, uh, and pushed the, the details, we were getting minor privacy incidents reported daily and sometimes multiple times a day. So it really becomes a training program if everyone's involved. Now, all those were typically, one of our clients sent us patient information in an email, which is not which is a violation. And part of the response of the officer who's receiving these reports is to examine it, bring in whoever else is required to look, ask the questions: well, what was the cause? Was it addressed appropriately at the time? What else should be done? If this is a failure of our policies and procedures, how should they be updated? And with an eye on the reporting requirements to understand when these have to be reported to a higher authority, which typically most garden variety incidents are merely sloppy with no no significant risk of going further. And then after some time, people get it down, and it just happens that there's more awareness. It doesn't happen nearly so often, and we start feeding back to our clients about what needs to be done to help heighten our security and our awareness. Now, thanks again. Thanks, Brian. Thanks, Linda, for the great questions. Let me just take one more overall look at this. You can do it yourself, even if you're a small organization. The ONC's tools has a self-guided assessment that you can do, and I'd urge you to look at that. It's not a bad idea to get a third party for help. They this is particularly the cybersecurity issues are a potentially daily changing, shifting foundation. New tools, new threats, and so forth. So having someone who's expert watching over those and making sure you're prepared for them to prevent intrusion, to keep your technical security safe is important. And I'll include a couple of references of people we've used and liked as we publish this Q&A. And feel free, I invite you to put in your own experience. I'm going to ask, as we publish this, who takes on these roles at your organization that can help us understand and help me understand the range of variation that's out there. Um, and if there's a third party that you've used and liked, please feel free to add them to the list to share with your peers. I want to be helpful. I want this to be useful to you. Don't hesitate to correct or supplement my answers. Share your experience. Ask your questions. We can be smarter together.